Welcome, and thank you for your interest in our Child and Adolescent Psychiatry Fellowship at Children's National in Washington, D.C. In this video, you will find information about what makes our program and our city unique and vibrant. Children's National is the premier provider of pediatric care in the Washington, D.C. metropolitan area and is the only freestanding children's hospital between Philadelphia, Pittsburgh, Norfolk, and Atlanta.
Hi, I'm Dr. Colby Tyson, and I am the Program Director of the Child and Adolescent Psychiatry Fellowship Program here at Children's National Hospital. We are so excited about your interest in our program, and we created this video to introduce you to some of our faculty and to showcase some of the unique opportunities that our program has to offer. Our fellows rotate through a diverse and broad range of experiences that are both hospital and community-based. Our hospital serves the Washington, D.C., Virginia, and Maryland areas, as well as patients transferred from across the globe. Our fellows are exposed to a diverse patient population as it relates to race, culture, education, and socioeconomic background, all in the various outpatient and acute care settings. At Children's, we strive to balance a culture of prioritizing education and wellness, all while preparing our fellows for the next steps after graduation. While I could talk at length about why it's so amazing working here at Children's, what stands out the most is getting to work with trainees, the collegial environment, and getting to work and learn from specialists both within the psychiatry department and within the larger academic institution. In addition, all of our faculty love teaching, which creates a very robust learning environment. So we hope you enjoy this video and learning more about our program.
Our Psychiatry and Behavioral Health Department was founded by the late Reginald Lurie and is one of the oldest in the nation. Its history of providing care to children with emotional and behavioral challenges and advancing the understanding and treatment of psychiatric illness in children is well established. Education, including our fellowship program, is a core component of the departmental mission, and teaching is a high priority for all of our faculty. Again, thank you for your interest in our program, and we look forward to meeting you.
Every neighborhood in Washington, D.C. has its own unique personality, from Columbia Heights to DuPont Circle and Adams Morgan pictured here. There are incredible neighborhoods in Maryland and Virginia as well. Our fellows live in a variety of places, depending on what kind of community feel they are looking for. The food scene is robust and ranges from neighborhood mom-and-pop restaurants to Michelin-starred cuisine and iconic places like Ben's Chili Bowl. And of course, there are wineries to explore right next door to us in Virginia.
Although DC is a big city, there are many opportunities to engage in the outdoors and in nature, whether you're going for a run in Rock Creek Park or kayaking down the Potomac River against the backdrop of blooming cherry blossoms. And just outside of the city are a number of wonderful parks such as Great Falls State Park, Carroll Creek Park, and the Shenandoah, where you can hike along the Appalachian Trail.
Ayman Saleh. I'm one of the attendings in the psychiatry department. I am the medical director for the outpatient clinic. I work primarily in the outpatient settings, and I'm a member of the anxiety disorder clinic. We're going to work together during the rotation in the outpatient clinic, and I'm looking forward to meet with you all.
Hi, I'm Dr. Laura Willing, and I'm one of the Associate Program Directors here at Children's National. While I am here for all fellows, my focus is on the second-year curriculum and helping fellows as they navigate the outpatient experience and prepare for next steps after fellowship. I also run the Advocacy and Mental Health Policy course. During your first year, you will learn about federal advocacy, state advocacy, the regulatory process, and mental health parity. During your second year, you will design and complete your very own advocacy project. Being in DC, fellows have testified on the Hill, annually participated in legislative conference, and have enjoyed learning various routes of advocacy. I also run the Anxiety Disorders Program, which is a 3-month rotation during your second year. We are excited about your interest in our program.
Hello, my name is Priya Panus. I am one of the Associate Program Directors of the Child and Adolescent Psychiatric Fellowship Program here at Children's National. I primarily work on the inpatient units and in the emergency room. I actually used to be a trainee here at Children's National and decided to stay on as an attending for a few different reasons. One of them, and probably one of the most important, was that I had the ability to become a colleague to a lot of the attendings that I had really come to respect and admire. Another deciding factor was the diversity of the patients that we see here at Children's. The demographic of the patients that we have locally, as well as this being DC, we have a lot of international patients that come through, and also the complexity of the cases that we see really provided an intellectual challenge that I couldn't turn down. As an attending, it's really been exciting to be able to pursue some of the interests that I had even in fellowship. For example, being able to continue working with Dr. Ritvo on play therapy, being able to pursue my interest in psychodynamics, and teaching as well. And speaking of teaching, I'm really excited to meet all of you who are interested in coming here to Children's National, and I look forward to meeting you soon.
Hi, my name is Dr. Kelly Register Brown. I'm the medical director of our Center for Autism Spectrum Disorders at Children's National. At our center, we have fellows rotate with us for clinical and research electives. For our clinical electives, we do multidisciplinary team autism diagnostic evaluations for psychiatric complicated youth. And for our research electives, we have particular research interests in gender and autism, autism self-advocates participating in research, executive dysfunction, and transition to adulthood.
In addition to the time you will spend in fellowship, Washington, D.C. offers an endless number of activities. Our fellows have regular wellness events that include Friendsgiving festivals, our annual retreat, and in the spring, our fellowship program protects time for you to participate in the ACAP Annual Legislative Conference.